Hello, everyone. It is Friday at noon, and that means that we are on to another episode of Focus on It Friday. Hello. Waiting for everyone to come on in. The time almost snuck up on me. I was like, oh my goodness. Hello, Miss Lovey. Hello, Miss Pat Keen. Thank you all for watching. Hey, Karen. Everybody's checking in. Hello, Dr. Andrea. Hello. Everybody come on in. We are going to have fun today. We are going to be talking about my favorite thing in all of the world of psychiatry, especially child and adolescent psychiatry, to talk about, and that is ADHD. And I am so glad that you all are here with me. Hello, Priscilla. Thank you for joining. Hello, Miss Luella. Everybody come on in. We're going to have a lot of fun today. Again, I could not have picked a better day to do my Facebook Live presentations. Miss Pat King says she is in Oldenville. Everybody's checking in. We've got some Georgia. We've got some Pennsylvania, Birmingham, of course. And I am so glad that you all are here. But Fridays have just been turning out to be beautiful days to come in and chat with everyone. Hello, Mama Diane Rudolph. Thank you for joining. Yes, we've had some beautiful Fridays. I'm going to be sad when we get a first rainy Friday, because it's just so much excitement to talk about in the world of mental health. Hello, Dia. Thanks for watching, you and Jeremy. So this is fun time. You know, I usually give everybody 3 or so minutes to come on in and join us for some fun. And so today will be no different. If you all have any questions, please go ahead and just drop them down in the comments. As I see them, I will address them. And if I miss them, then I will make sure that I come back and let you know what the answer is to the question. And if it's something that I happen to not know, I'm going to be making it my business to find it out. But hey, Taria, I see you just liked the page, so thank you for joining us. Taria is my dear sorority sister, and she has been telling me for a very long time, sis, you need to be live. So thank you for joining and having all of your friends to join me as well. Speaking of that, go ahead and make sure you go down your friends list and invite all those people who need to know something about mental health, which would include everybody on your list. We all have something to do. Hey, Relinda, nice to see you. Thanks for watching and joining us. All of the people on your friends list have something that they can learn related to mental health, and this is a place that they want to be, where we are giving you down-to-earth, good old Southern friendly but accurate advice about mental health. So I encourage you to make sure you invite all of your friends list. Don't just post about it. Go in and tag them and have them to come and join us so that they can get in on the fun. Also, the past videos are still up and available, and they will be until the next venture comes along. And even then, they will be there. But we do want them to take advantage of everything that we have. All right, so it's 12:04, so I'm going to go ahead and get started. I am Dr. Brandi B, your triple board certified pediatrician, adult psychiatrist, and child and adolescent psychiatrist. I help worried, overworked, overwhelmed, stressed out, and plain old tired moms and dads learn all that they can about their child's mental illnesses, including ADHD, so that they can help them to be focused, behave, and be successful in the classroom and in life. Hi, Auntie Rosalind. Thank you for joining us. So today we are going to talk about the benefits of treating ADHD. So a lot of people don't even know what ADHD is, and some people even don't think it exists. A lot of people say, just beat those kids, just whip those kids, and then we're going to pray about it. And to be honest, I'm always a fan of prayer, and if you want to whip them and it works, then I say go for it. But what a lot of parents are finding by the time they come to see me is, oh my goodness, I'm whipping this kid every day. I even knew of a family where the kid just came in every day and assumed the position because he knew he had probably done something at school or was going to do something at home that was going to warrant him getting a whipping. So he would just come in and assume the position. And it wasn't until his parents got him some treatment for his ADHD that he was able to calm down, not assume the position, at least for not his behaviors on a daily basis, and to actually be productive and do well in the classroom. So as you all know, I'm really big on education, and I don't like to just jump in. Hey, Frida, thanks for joining. I don't like to just jump in and assume that we know what Dr. Brandi B is talking about. So I want to first tell you what ADHD is. ADHD is a neurodevelopmental disorder. All right. So that means neurologically, and developmental, meaning that things did not come together as they typically do, and as most parents thought and hoped that they would have when the child was developing. And so ADHD is a combination of problems with children being inattentive and or being too hyperactive or too impulsive. So I want to go over the criteria with you just to make sure that you're comfortable with what it is, okay? Oh, let's talk about what it is not, though. ADHD children are not simply bad children, okay? So a lot of times people will say he's just bad. And these kids do have some problems with behaviors, but they are not necessarily just bad. It's not like they're just making a choice to misbehave, if you will. Hi, Angela. Thank you for joining. So they're not just bad, right? They have some challenges. Certainly, like people who are diabetic, just don't have high blood sugars because they don't want to. Now, certainly there are some behavioral things that we can do as parents to help them, but these children actually want to perform and do well like every other child does. So they're not just bad children. Chocolates can't do it, all right? So chocolates are probably bad for your teeth and bad for your weight, but chocolates and sweets and sugary beverages are just not causing kids to have ADHD. Poverty is not causing kids to have ADHD. And if you don't believe it, go to your local suburb, look at the children there who have ADHD, and they have 2-parent homes, white picket fences, a dog who brings the newspaper to the parents when they walk in the door, and a mom who stays at home all day and does a perfect job of homeschooling. And these kids have perfect scores on their ACTs when they graduate, but they still had ADHD. So it's not a result of poverty. It's not a result of their diets, okay? And it's not that the kids are bad. These are some of the more common things that I hear. I also just want to go ahead and throw out something right now that you should know, that fascination and concentration are not the same thing. So a lot of times parents will say, well, he can focus on that video game all day. He can focus on this reading, writing, and arithmetic. Well, it's a little bit different. Your video games are constantly moving. There's ping pong, bow, wow, wow, bright colors, flashing lights. All of those things are happening on a video game, but they're not happening in a book, at least not the ones that I read to get to where I am. So it's very important that we understand that there is a difference between fascination and concentration. They are not the same. All right, so if you remember nothing else, just remember that they aren't bad and that fascination and concentration are not the same thing. So then what is it? Now, there are 3 types of ADHD, because a lot of times parents will come to me and in their minds, I think they have kind of reconciled with the fact that something may be going on with their child. And so they'll quickly tell me, but my kid has ADD, not that ADHD. And so then I have to tell them, right now, according to our DSM-5, which is the version of the book, if you will, that we make all of our diagnoses for mental health disorders. In the 5th version, they said, and even before then, they said there are 3 types of ADHD. All right, so it's all called ADHD. The ADD went away, but what is most similar to ADD is the inattentive presentation of ADHD. So with the inattentive presentation, and I sometimes will loosely say inattentive type, but it's predominantly inattentive presentation. These kids will lose things, forget things, be disorganized, procrastinate, rush through things and make careless mistakes, sometimes not respond when they are addressed or spoken to. And then they just cannot complete tasks, all right? So they have a hard time getting started, and sometimes they don't even finish. Those are all inattentive symptoms. Hi, Tan. Thanks for joining. Hi, Amber. Thank you for joining in Mobile. Thank you. So that's the inattentive presentation. And those kids, they don't pay attention, easily distracted. All right. And so you come home from work and the trash is not taken out. You think they're being defiant, but in fact, they were on their way to take out the trash, saw their favorite show, watched it, and forgot. So remember, those are all things that I said. Forgetfulness, easily distracted, losing things, forgetfulness, like losing track of time even. That's something that we can lose, okay? Those are all symptoms of the inattentive presentation of ADHD. All right. Oh, and thanks, Tan, for my jewelry. Thank you. The pretty shop. All right, so when we talk about the hyperactive impulsive type, this is what most people think about when they think of ADHD. And this is what parents are quick to say, but my kid didn't have that. They've got the ADD. So, all right, so I'm very, very, very careful of making sure that they understand the nomenclature. All right, Angela, don't do him like that. That's not nice. She's trying to tell on her son. I think he may forget every once in a while, but he's a Morehouse College graduate, so whatever he did, it worked out for him, and we're proud of him. All right, so we're going to move on to the hyperactive impulsive presentation. These are the kids that, like I said, it's what you most likely think of, all right? They're hyperactive. They're on the go. They can't stay seated. They blurt and they interrupt. They fidget. They are loud, and they're also talkative. Hi, Dr. Laura. Thank you for joining. They're loud. They're talkative. I mean, these are the classic poster children for ADHD. And it doesn't take a psychiatrist or even anyone who has ever seen a child to know that kid is a little bit different. They can't sit still, okay? But that's okay. We can take care of them too. All right. So you've got your inattentive presentation. You got your hyperactive impulsive presentation, and then you got the third type, because I told you that there were three. Hi, Miss Judy. Hi, Dr. Enkarika. And that is the combined presentation, all right? So your inattentive presentation, your hyperactive impulsive presentation, and your combined presentation. Those are the three types of ADHD. And remember, they're not bad, and fascination and concentration are two different things. Y'all heard that here first. I'm going to have to trademark that. All right, so we talked about what does not cause it. Let's talk about what can cause it. We know for a fact that it runs in families. So about 41% of moms who have ADHD and 51% of dads who have ADHD will give their ADHD to their children. All right, that's a lot of parents who are walking around with ADHD. And you know what happens when I'm calling out those things, kind of like my sister-in-law Angela said about someone in her family. A lot of times parents will say, this all sounds like me. But in the 80s, my mama didn't believe in that. In the 70s, it probably wasn't even thought of. And in the 90s, my mama knew about it. Somebody told her I had it, but she chose not to treat me. Hi, Uncle Maurice. Thank you for joining. And so that's very common. And so then if I just say, because I'm a board certified adult psychiatrist as well, sometimes I'll just stop the interview with the child and say, Mama, tell me about your job history. And then they tell me, well, this year alone, I've had 6 jobs. Well, wait a minute. We're in the 7th month of the year 2020. You've had 7 jobs? So then I might say, well, tell me what happens. And the mom might say, well, I got fired from the Mercedes-Benz plant because I kept taking breaks without anybody knowing. Or I took a break when they got on to me because my job was to apply the door handles. And at first I was taking breaks and nobody knew I was gone. And so tons of cars would go down the assembly line and wouldn't have door handles. But I was just like, get distracted and see my friends in the break room after I came out of the restroom, and I just sit down and talk with them. Uh-oh, mama. All right. So now this is how it can present in adulthood, because guess what? It doesn't go away in childhood. All right. So a lot of my colleagues don't understand that. And at 18, a couple of things happen. You get off your parents' insurance, you go off to college, you don't feel like you need it, you're an adult now, and so child psychiatrists may not be interested in teaching you. Hi, Rosalind, thanks for joining. They may not be interested in treating you, I'm sorry, but the adult psychiatrists may not even really understand it, believe it exists, or they may think you're drug seeking. So here you are trapped as an 18-year-old trying to go off to college. And so it's very important for us to understand that it keeps going. All right. Going back, though, because I get excited, y'all. I get so excited, especially about this topic. But we do know that it runs in families, okay? So it runs in families. If your mom and dad or dad had it, then there is a much higher percentage or much more likelihood that you will have it as well. We know that if you were born very small, or if your mom smoked cigarettes while she was pregnant, that could lead to it as well. And remember, smoking cigarettes does lead to smaller babies, so we definitely don't want moms to be smoking, okay, while they are pregnant, or doing any other illicit substances while they are pregnant, for that matter. Let's see, environmental toxins like lead. So if you were exposed to lead, or if you have what some kids have, which is called pica, P-I-C-A, where you eat things that do not have any nutritional value. So that is very important, because these kids eat everything: grass, paint chips, anything like that. So that can be very, very, very important, because houses that were built prior to 1978 have lead, more than likely, in the paint. Now we see things like unleaded gas. This is why it's important. The paint had lead. Everything had lead in it. Sometimes even the soil. So you want to watch those kids who mouth, which is appropriate for babies, right? But lead toxicity or lead poisoning can present with symptoms of ADHD. This part of your brain up here, which we call the frontal lobe, okay, that is the part of our brain that says yes, no, stop, go. That's our personality. That makes me be bubbly and excited. Okay, so if I injure that part of my brain, whether I hit the dash or a steering wheel on a wreck, or I'm in combat and I get hit in the head in war, or I'm in an abusive relationship and I get hit over the front of my head, or I have a stroke that affects the frontal lobe, I may not be my normal self or my typical self, because the frontal lobe is where my personality resides, but my frontal lobe is also where I learn inhibitions. Don't do that. Bad idea. You did it last time, it didn't work out. You remember your Uncle Joe? It didn't work for him. No. Danger. X. Okay? So if I injure that area, I'm not likely to either remember Uncle Joe, or I just don't even care about it. And I'm going to go do it anyway. Okay? Now, something very important. Frontal lobe. Let me just tell you about this real quick. I'm all off script, y'all. But I just like to, I get so excited. Oh my goodness, I get excited. Because I get to share with y'all what it took me many, many, many years to learn. And I'm still learning. I love it. I'm still learning. Your frontal lobe doesn't develop until, maybe your mid to late 20s. So doesn't it make sense that this is why adolescents go out and they do silly stuff? It's a part of our development, right? We all did silly stuff in our adolescence. Some of us did stuff more silly than others. And we thank goodness that there were not things like cell phones that could record it, all right? But it is into our 20s that the frontal lobe develops. So now if you take, hey, Dr. Belinda, thanks for joining. So if you take a child who is already impulsive and is doing some dangerous and risky stuff, because that's what adolescents do, but then you throw on something like ADHD and it's not being treated, oh my goodness, they're going to get into some trouble. So that's what we're going to talk about today. We're going to talk about the benefits of treating ADHD. All right, just so you know real quick, how does ADHD present? Kindergarten, first and second grade, it's going to be a lot of hyperactivity, rolling around on the floor, sliding out of the chair, climbing up the walls, motor. Parents saying things like the kid is driven by a motor. That's your young children. The younger that a child is when they come to someone like me, that means that they have more significant issues, problems. They're more hyperactive. They're more disruptive, okay? So please don't judge those parents talking about them altering their brains or whatever else. Their brains are going to do what their brains are going to do, but they may get hit by a car, and then we will never know what their brain was going to do. You get it? That's why it's so understandable. Thank you, Dr. Belinda, girl. I bet you cute, too. Thank you so much. You just making me blush over here. All right, 3rd through 6th grade, right? 3rd, 5th, and 7th grader. Now, I'm no educator, but I hang out with a couple, and they tell me that those odd grade years are very, very, very important. There's a shift in the way that things are taught and in the level of difficulty of the information. So that's also important, because by 3rd grade, most kids can keep it together and not be as hyperactive. They can stay in their seats, but their minds are still wandering. So by 3rd grade, I'm getting a lot of kids coming in about December, And they are struggling, barely making it, all right? What I'm also noticing is that in 7th graders, I'm seeing a lot of presentation of anxiety. My kid doesn't want to go to school anymore. My kid cries when he gets to the doorstep. My kid is vomiting and having panic attacks. And when I do a thorough history, because that is the #1 way that ADHD is diagnosed, what I'm actually finding is this kid has ADHD. And mama and them been praying about it, all right? And I'm not saying that God didn't answer prayer, because Lord knows he's answered all of mine, okay? I get down every night. But sometimes he gives us answers and we've got to act on them. And sometimes that means let's be honest with ourselves and let's get that baby some help. So what are the benefits? I'm glad you asked. And I always take notes, because while I know all of this, I get excited, as y'all can see. Can y'all imagine what these would be like if I didn't have any notes? I could talk to you on and on and on forever, because I get that excited. First thing we need to do, though, I want to tell you, this is not going to be about what medication to put your child on, because there are so many other treatments to use for ADHD. But I want you to hear this. The gold standard and most effective treatment is stimulant medication. Now, I know y'all don't want to hear that, but Dr. Brandi is just honest with you, because I don't want you, oh, Sis Priscilla say I'm looking jazzy. Y'all are too kind. Y'all are too kind. But I do want you to know what the truth is, okay? Because I would not be practicing good medicine if I didn't just come on out and say that. But there are some other things that parents use, and they can be helpful. But I want you to know what research has proven, because I'm an evidence-based, practicing physician, board certified. So I'm going to tell you what board certified medicine proves and has told us. So get your kids some medicine if that's what you choose to do. You may not choose to, and that is your kid, and that is fine. But some of the benefits, we're going to talk about benefits in medical, social, at home, and at school and work. Now, go back to what I said the kid looks like who has ADHD. Just what are the criteria? Not being able to complete tasks, losing things, forgetting things, not getting started, rushing through and making careless mistakes. 2 + 2 = 5. They know it's not 5. So I want you to hear me very loud and clear. This has nothing to do with your child's intellect. Hello, Cecilia. Hi. Who is that? Oh, T. Renee. Thank you. T. Renee. Oh, that's Tyree. Oh, hey. All right. It has nothing to do with your kid's intellect, right? Very bright kids will fail. Do you hear me? Very bright kids will fail because they can't focus. Unfortunately or fortunately, our society is produce driven. All right, what can you produce? Can you give me the answer on the test? And if the answer is no, you can't give it to me in the amount of time that I allot, then that's what I have to go by. So if your kid is spaced out for 50 minutes of a 60-minute exam and all they get to are 30 questions out of 100, but they got them all right, that's a 30% and they failed. So this is how kids end up failing. So academically, your grades are going to come up. You're going to be making the honor roll that you know your kid could make. A's and B's all the time. So parents want to say, well, my kid is smart, and I believe that your kid is smart. But if they can't produce it on a test, nobody will ever know. All right? So we got to be able to produce. And that's one of the main things that parents are going to notice. Right away, after that first day of treatment, they're going to notice my kid could focus. And the trash actually got taken out at the time that I asked them to take it. Hi, Auntie Brenda. Hi, Mimi. Thanks for joining. So academically, the grades are going to come up. And remember, I talked about adults, okay? This just doesn't stop at 18. ADHD doesn't stop at 18. All those parents who've had 7 jobs in 6 months, all right, they're going to be able to stay on one job because they will actually be able to go to the restroom and come back to their assembly line job, all right? I have treated people that have worked in high executive positions because deadlines would come. That's how it usually presents in adults. They miss deadlines. They miss appointments. They're running into the appointment with me. I'm like, did you take your medicine? Okay, so to make deadlines, to keep appointments, to juggle things like I have to juggle, I can only do that because I'm super organized both in my mind and in my time, okay? Nothing like making a list and guess what? Losing it. That's what happens when you have ADHD. And you say, I'm going to put a timer on my phone. and you lose the phone or you left it at home. Don't know where your license is. You lost your debit card 12 times. This is how it looks in adulthood. So for school and work, it's going to help those grades. And I mean, it helps them. Now, let me be very clear because I don't like to mislead anyone. If your child struggles academically, treating their ADHD won't make them struggle less academically. It will help them focus. If they have some other issues like a learning disability or they need, some special help, then we got to talk about that. And since I'm here, children with ADHD do have processing speed problems. So the information comes in the ear, and usually it comes in, goes out, and either they say it or they do it. Children with ADHD, it comes in and it goes squirrel, light, elephant. What'd you tell me to do, mama? Not productive. All right, that's what happens. So we got to increase that processing speed, and sometimes that means we need special education. I know that y'all don't like that word either, but sometimes we need an IEP, a 504, and all that other stuff that my fabulous friends in the education world do. All right, and then lastly, it's going to work to make better behaviors at home and at school. All right, so improve grades, you're going to perform on your job, you're going to get a raise, and then the behaviors are going to be better, right? So now mom can actually cook and not worry about somebody flying by and knocking the pot off the stove, and then the kid gets burned, right? These are real life things that happen. All right, in the home, less hectic. You can always tell the child who has ADHD in the home because they are barely able to make it out the door. The school bus comes at 6:50, and at 6:42 they finally decide to get out of bed because they procrastinate and wait till the last minute. So now they gotta rush. So now they leave their book bag. So now they call you in first period because they forgot their math homework, okay? All right, so the home life is less chaotic. This child is actually going to be able to get their clothes out at night, put their book bag together. All right, you're going to be able to cook. All these things are going to happen. Hey, Tamika, thanks for joining. And then there's an improved relationship between parents. Now, in any relationship, mine included, I have a great marriage, but every once in a while we just have disagreements, right? But can you imagine what happens in a relationship where there's a child who there's always some conflict about? Somebody's always got to take off from work. Somebody's got to always go to the school. Eventually, it's your turn, and it's your turn starts to wait on a marriage, or that kid has knocked over one more thing, or that kid has been put out of this school. And so now you have a situation where you're looking for child care. All of these are things that can help weaken a marriage, weaken a parental relationship. So treating that child's ADHD makes that better. Never thought about it that way. That's what you got Dr. Brandi B for. And I'm so glad you're here. Thank y'all again for joining. All right, and then social and emotional. Think about the child now who has, parents always say, I don't want my kid labeled, but think about the child who has been labeled. And by the way, whether or not you call that child ADHD, people are whispering. They know something is going on with that child, whether you tell them or not. Okay, it does not take all day to see the sun shining, and people certainly know that something is unique about this child. This child is very bright, but he cannot stay in his seat, and I'm a little bit concerned, all right? So eventually, all of that wears on a child, right? And then their self-esteem goes down, all right? And so if they are, thank you, Stacy. Oh, man, y'all are so nice to Dr. Brandi B today. I'm so excited. So their self-esteem, Stacy gets to see me every day. She's one of my nurses. I have the most amazing nurses. And so Stacy gets to see me in real life doing telemedicine, sitting here seeing upwards of 30 patients a day. And sometimes I don't look like this, y'all. But I'm in the grind. I'm trying to get these kids ready to be in virtual school, home school, day school, your school, my school, whatever kind of school they're going to. I am passionate about making sure these kids excel because, yes, this is a different setup. So it adds a different level of what? Distraction. All right? This home school, home at school, school at home, I don't even know what it is. It's going to be a different level of distraction, right? So we need to make sure that these kids are treated. But I digress. Thank you, Stacey. Self-esteem, it goes down, all right? You get to the third grade, you were coasting along, K1 and 2. The teacher said, see Jane run, and you could do that, yes. Third grade comes, she says, great, Johnny. Now, how was Jane moving? And you don't have a clue. All you can say is see Jane run because you know those 3 words. But what the teacher asked you was to take that information and interpret it. And so you could not give her she was running. That's all she wanted to know was Jane was running. So now in third grade, your grades slip. And now you hear your parent and your teacher talking about things like keeping you in third grade, all right? And so the mood goes down. I don't like school. I don't want to do my work. A lot of times parents will tell me they can do the work, she just doesn't want to do it. Newsflash parents, your kids want to do the work. All of them want to do the work. Kids want to please us. And in my impression, until proven otherwise, there are only two reasons that kids don't do work or don't want to do it. They don't understand it or they can't focus on it. So if you've got a they just don't want to do the work kid at your house, be honest with yourself. Don't type it here. Nobody can see. I can't see. They either don't understand it or they can't focus on it. So make sure you're honest with yourself so you can get your child some help. But the self-esteem is going to go up. They're going to make those A's by the end of that first week of treatment, and they're going to be like, mama, mama. And then you're going to call me and you're going to say, Dr. Brandi B, and I'm going to say yes. And we're going to have a party right there. And I'm going to say, let's keep it going. All right? They're less likely to engage in risky behaviors. That's number 2 from the social emotional. I've mentioned to you risky behaviors. Remember, kids are forgetful. So in the summertime, they forget. They don't know how to swim and they jump in the deep end. Thanks for watching, Danita. Hello. They forget to look both ways before crossing the street. So they run out and get the ball and they get hit. They're going off to work to take the ACT. I had a kid take the ACT. This was back when it was paper. He forgot his pencils. How you forget your pencil? And you're going to take the ACT and you know it's a paper and pencil test. So they're forgetful. So things are going to get better. But when they turn 15, 16, 17, and they're driving, and they forget to look to the right and the left before they change lanes, now they've caused an accident. Or they forget, right, to go the speed limit. So they slide on off the road and hit a tree. All right, now you got a total car. Now the insurance wants to know from me, what were they prescribed? When were they taking it? Were they coming to their appointments? And you're looking at me like I'm going to do something unethical. No, I like my job. As y'all know, I got 3 babies, okay? So I'm going to keep my license, all right? So now they pay for that accident, but this is the 3rd accident in 2 years that this child has had that were their fault. They're not going to insure that kid anymore. All right. Other social things, improve relationships. Improve relationships. I talked about the relationship between the parents, but kids know too. All right. So kids will stop inviting your child to birthday parties because they're tearing up stuff. They don't want them there. All right. This happens. This is real life, folks. Fewer run-ins with the law. Again, not only with accidents, but just being impulsive and doing silly stuff. Go back and listen to the beginning of this where I talked about the frontal lobe. It's some interesting stuff there and amazing stuff. So if your frontal lobe is not intact, if you're doing anything even lawful, if the police put their lights on, you're running. All right? And we know what is going on in the country with the law and all of that, but you need to be thinking. You don't need to take off running. That's a bad thing to do. All right? Less motor vehicle accidents. Less likely to get on drugs. Now, remember, I talked about it. I didn't get to the teenage years. The presentation of ADHD. Kindergarten, 1st and 2nd grade, they're hyperactive. They're rolling around on the floor. Then you get in the 3rd, 4th, 5th, 6th, and 7th grade. They're inattentive. Those grades start to decline. 7th and up, even into adulthood, I call that drug, sex, and rock and roll. Remember, we talked about being impulsive because your frontal lobe has not fully developed and has not told you stop, go, no, bad idea, right? So a couple of things started happening in the 7th and 8th grade. It didn't happen with me because my mama she didn't let me do nothing. But I still love her and it worked out. So thank you, mama. But you start letting your kids go out with their friends. You start letting them even maybe spend the night. They get a boyfriend. They get a girlfriend. They have more time away from you. They are in social and extracurricular activities that do not require you to be there. And so now they are around all these people, sometimes unsupervised. And my auntie's laughing because she knew she was the only way I could do some stuff sometime. But anyway, I digress. So they get around their friends. And their friends may offer them something to drink, smoke, or swallow. All right? Now, I told you they were impulsive at baseline. But now they are drinking, swallowing, and smoking things that looks cool. And so all inhibitions are off. They are uninhibited, all right? So they try it, right? So they experiment with this, experiment with that, and I'm going to just throw this out there. Check on your 8, 9, 10, and 11-year-old family members. They are doing drugs, okay? Don't think that it happens at 16. It's happening at 8, 9, 10, and 11, and it's usually somebody that you trust them to be with, an older sibling, an older cousin, or just the kids in the neighborhood who may have older siblings and cousins. But that's a whole nother lecture. For right now, they're trying things because they're impulsive. They find their way to things that help them focus. All right? And, 7th grade, the other thing is that in addition to being impulsive, hanging out with friends, being away from you, that is the age that if they have been treated in the past, they decide they no longer want their medicine for ADHD. So they stop taking their medicine. So now they're even more impulsive, right? They start experimenting. They find things that help them focus. And before you know it, they're making A's and B's. They're excited. But then those things are much more potent than what I can prescribe to them. So now they're hooked. And their teeth are missing. They're scratching and they're itching. And you wonder what happened to your beautiful cheerleader. All right. So ADHD is very serious. And this is why I'm so passionate about it. Because these kids do not have to suffer. And yes, they suffer. They do not feel well. Older parents, and I'm talking older as in 7 or 8, will say, I can't stop. They can't stop moving. So imagine you wanting to stop, wanting to go to sleep, and not being able to. This is the life of a child with ADHD. But then you got people calling you bad for something you can't even control. And your grades aren't good, but you know you're a smart student. This is ADHD. All right, and then medical. Less risk of depression, less risk of anxiety. Remember, I talked about that with the 7th graders and up. Decreased risk of injury. All right. So I think that's all. Oh, parents can stay at work. And other people will keep your children. I can't tell you how many people say to me, nobody will keep this child. Okay. You get them some help. Somebody will keep them. But no, nobody's going to have your kid at their house tearing up their stuff. It's not going to happen. All right. Overall, your kid is more likely to be more successful. And that's what Dr. Brandi B is here for. Just some tips, parents, if your children are taking medication, you can just wink once, all right? Just wink once, and nobody will see you. Make sure that, and this is for anybody who gets a medicine that a physician prescribes. If you don't leave your pharmacy with your medicine, your doctor has no way of knowing that it wasn't filled. So if they tell you it needs a prior authorization, make sure you call the doctor's office back and let them know. I'm a psychiatrist, not a psychic, okay? If you don't tell me, I don't know. So call your doctor's office and let them know. They say we're going to need a PPP. We know what you're talking about, and we'll get on it. The other thing is make sure you go and fill your child's prescription every month. And let me tell you why. This happened to a patient just this week. Insurances, don't tell them I told y'all this, but they look at all sorts of numbers, okay? And so they want you healthy, but they're in business, right? So if they go back and look and they determine that you've only filled your medicine every 3rd month, then they assume you only need it every 3rd month. So then when it's time for me to get you a medicine that does need a prior authorization, and you have to have had 2 medication trials in the past 3 months, and you're going to say, well, great, we've had them. And then they go back and look, you've only filled 3 medicines in a whole year. They're going to say, nope. So now we got to start over. So the moral is, make sure you're filling and taking your medicines as prescribed. Now, I know somebody is going to say, but Dr. Brandi B, I don't give my kids medication in the summertime. What do you think about that? And this is what I think about that. First of all, I think that's your child. And so you do as you think you feel is best. And we talked about that last week with returning to school. You've been raising this kid for as long as this kid has been on the planet. Keep doing it. Apparently, you're doing a good job. They haven't died, you haven't died, and if DHR hadn't been involved, you are learning, you are figuring it out, all right? So be confident in your decision. But I do want you to know this. ADHD is a 24/7, 365-day disorder. Remember I talked about the kids who were swimming, the kids running out in the street? All that stuff happened on weekends and in the summer, right? So, and they're driving every day, okay? So, do as you wish, but remember what Dr. Brandi B told you. This happens every day. So, fill your medicines. Make sure you let us know, all right, your doctor's office, and then remind us. I tell everybody I know, please give me a gentle reminder. I have 3 small kids, a husband, and a couple of different jobs. And I'm very involved in the community and everything else. So if something is not phoned in, or if something didn't get taken care of, or for heaven's sake, if you need a letter or a form filled out, which are my favorite things on the planet to do, and it didn't get to you when you thought, first of all, don't give it to me at the last minute. Don't do your doctors like that. Give us some time to get your forms back. Now, if it's urgent and you just got it, of course. But if you've had it for 3 months and it's due next week, don't do that to us, please. But remind us. Let us know. Hey, did y'all forget? Just saw somebody. I squeezed them in Monday and I forgot to sign the script. It happens, okay? I'm human. But just work with us. Remember, the ultimate goal is for your kid or for yourself or for your adult, college, medical school age child to actually do better in life. All right, that's my time. It's 12:40. I'm going to get these down to 20 minutes, y'all. I promise. Hello, Hera. Thank you for watching and joining us today. Hopefully this was interesting. Y'all didn't have any questions today. I think I saw something from Miss King. She says, wow, that's good. I can listen to you, Dr. Brandi. Great information. Thank you so much. Again, if y'all have any questions, any comments, any concerns, just say, hey, this is great or this is garbage. You know, let me know that too. At least put the garbage part in my DM though. But I do get excited about this. I do get passionate. I do feel like, yes, a lot of kids have ADHD and the world wants us to believe that everybody is being treated for it, but that is not at all the case. 6 to 8% of kids are being treated for ADHD. It looks like 100% to me, but if you're a hammer, everything is a nail, right? Hey, Shafiqua, thank you for joining. Oh, thank you, Cecilia. She says it's not too long, but I ain't gonna be like the preacher and keep going. I'm gonna let y'all go because it's Friday and it's beautiful. But I do want you to strongly consider your children, your grandchildren. Thank you, Auntie Roslyn. And anybody who has that you have a relationship with, if you think their parent may listen to you, then go ahead and let them know, hey, go listen to this thing about Dr. Brandi B. There's another one on here too that I have about what ADHD is and what it isn't. You might find that interesting as well. And just go and take a gander. Hey, Lauren, thanks for watching. That's right, that's my sister. Take a gander and listen to all of my videos. I personally think they're good, but hey, if I didn't think they were good, I wouldn't be doing them. But it's full of information and it's stuff that we ought to know. All right, we've got to know how to take care of ourselves. We talk about therapy, that's one of them. Just loaded with good information. Eventually, I'm going to talk about medicine because I know y'all like, well, which ones? But I don't want to do that because people are scared of medicines. And we will talk about that. And so I'm just trying to ease y'all in, right? But I want to give you the benefits because if you know the benefits and you know your child is suffering, then hopefully that will be something that will help you to say, let me check into what some of these things are. And you don't have to jump to medicine. There's meditation. There's organization skills. There's all sorts of things that you can try before medication. But remember, evidence-based medicine says that medication is gold standard. It's what's going to work, all right? And it's just a matter of finding the right one. All right, y'all be good. Take care of yourselves. Coronavirus is still real, okay? Wear your mask. Wash your hands. Frequently, 20 seconds with warm water. Stay away. Lauren says drugs are good. Lauren is my sorority sister and my dear, dear friend, and she is a drug rep, right? And so Lauren keeps us safe, and I'm so proud of her and glad to have her on my team. In my circle of friends. But yes, wash your hands, stay away from folks, wear a mask. And like I mentioned last week, your nose is your new private part. Nobody should see it, all right? If you don't live with them, cover up your nose. We don't want to see it. It's the new private part of 2020, all right? I love y'all. I thank y'all for so very much for being here with me. You could be anywhere on a Friday afternoon, but you're here with Dr. Brandi B, and I really appreciate that. I really value y'all. And the people that have been rocking with me from the very beginning, I'm gonna remember y'all one day. You just hang in there with me. Love y'all. Thank y'all. Have a great weekend. See you next week when we'll be discussing something fun on Dr. Brandi's Focus on It Friday. And in closing, make sure you let all of your friends know that we're here. We're hanging out anywhere from 20 to 40 minutes if I go a little bit long. And that we're having fun and we're learning over here on my Facebook Live. Just go ahead and click like and share this with everybody, and go ahead and invite your friends. Do that for me. I'm giving you all of this. I just want you to do that in exchange for me. Love y'all. Thank y'all. And I am Dr. Brandi B, your triple board certified child and adolescent psychiatrist. I help worried, overworked, overwhelmed, plain old tired moms and dads of children with ADHD come on in and learn all about it so that they can do 3 things: help their kids be focused, help their kids behave, and help them to be successful in life and outside and inside of the classroom. See y'all next week. Bye-bye.